By joining the North Carolina Nurses Association, you will become part of an organization that has been a leader in the profession of nursing for over 100 years. The NCNA was founded by Mary Louise Weish and a group of nurses in 1902.
The North Carolina Nurses Association was the first association to create a board of nursing to issue licenses to RNs. We celebrated that in 2003. So we had the first Practice Act in the United States, and therefore the first registered nurses were from North Carolina.
NCNA was the voice for nursing in North Carolina, and I wanted to be part of that. And have had many opportunities since then to take on leadership positions. So I think NCNA kind of grows their own leaders, and this is a wonderful place to learn more about your abilities.
Members of the North Carolina Nurses Association are recognized nationally for having a significant impact on the profession and for providing quality care in a variety of practice settings. The North Carolina Nurses Association, NCNA, leads the charge in the quest to keep North Carolina nurses on the cutting edge of nursing policy, education, practice, and more. NCNA works diligently on behalf of all nurses to make North Carolina nursing workplaces the best in the country. Recent initiatives include implementing safe patient lifting and movement practices, as well as addressing the nursing shortage in North Carolina. NCNA's Hallmarks of Healthy Workplaces program is a premier initiative designed to recognize nurses, healthcare providers, and administrators who create workplaces where nurses influence their own practices and contribute actively to facility functioning so that the ultimate in quality service may be provided.
I chose to join NCNA when I first came to the state in 1981 because I'd heard so much about it from other states that I'd been in. When I was in Boston in graduate school, they talked about NCNA doing so many cutting-edge things. They talked about North Carolina and North Carolina's, invigorating opportunities. And so joining North Carolina was a no-brainer. Coming to North Carolina and being a member, I think in the first 3 weeks I was here, I made my call to headquarters and said, how do I get involved?
NCNA is your voice at the North Carolina General Assembly and in other settings. Recent legislative successes include securing increased scholarship funding to recruit additional nurse educators for North Carolina community colleges and universities, increased funding for school nurses, the Nurse Scholars Program, and for nursing programs and allied health. NCNA has also had many years of success defending the practice of nursing at the legislature and protecting the scope of practice for registered nurses and advanced practice nurses in our state.
In the 1980s, there was the Medical Society decided to create a new healthcare provider that will be able to do many of the tasks that nurses do, and they can be paid a lot less. And so, and they were going to try to pass this bill at the legislature. So NCNA heard about this, and they called the membership and told them to contact the legislature and try to kill the bill. And in fact, that's what happened. So it just really made me proud to be part of an organization that's truly an advocate for nursing and the profession.
The North Carolina Nurses Association welcomes all registered nurses to join. A variety of membership options are available, with special discounts available for recent graduates, full-time degree-seeking students, retirees, and more.
I don't think that the reasonable excuse is the cost. I think the reason that many nurses feel unable to join is because they don't feel that they have the time. In this association, everyone can have the time, and the time that you have to devote is what the association needs from you.
Providing opportunities for education, professional development, and networking is a big part of what we do at NCNA. And perhaps the factor that our members cite as the greatest value is the opportunity to network with nurse leaders from across the state.
When you join the association, you meet nurses all across the state who are doing all sorts of things. You wouldn't know those nurses if you weren't involved in the association. As you grow in the association, people begin to know you by name. You make professional relationships and connections that you wouldn't have if you weren't in the association.
Through involvement with the association, you may find your next mentor, your next employer, or your next nurse friend.
Probably the most important thing, though, is making friends within the organization. And many of the members here have been lifelong friends of mine. We just kind of grew up together in the organization.
I get more hugs here than anywhere except maybe at home. And it's just for me, it's been career enhancing. It's given me an opportunity to keep in touch with how nursing is evolving, but it's also given me a great network of friends and acquaintances from the years. And as I get older, those become more and more important.
You will also find opportunities to develop yourself professionally outside of the classroom or convention setting.
I think many of the nurses who are members of the organization are leaders, and I thought what a great way to learn from the best, be mentored by some of the best leaders in North Carolina.
The benefits of being in the association have extremely influenced my career. I think it has put me in places with other nurses who've been in the profession longer, who've been in leadership positions longer, and I think that's probably one of the biggest benefits. The association develops you as a leader in nursing.
NCNA offers a number of other benefits that save you money, such as discounts on ANCC certifications and professional liability insurance, low-interest loan consolidation for school loans, and more. NCNA members also receive preference for several scholarships through our very own Foundation for Nursing. We recently implemented a new benefit that saves you money on uniforms and scrubs. NCNA gives you the opportunity to participate in practice and specialty councils, committees, and task forces, as well as access to information and publications. By joining, you make the statement that being a registered nurse is more than just your job. It is your profession. NCNA is here to support you and your profession, both now and in the future. Make a strong organization even stronger by joining today. All registered nurses need to belong to the North Carolina Nurses Association.
I'm Cassandra, and I belong.
I'm Frank, and I belong.
I'm a nurse educator, and I belong.
Interim Associate Dean, Winston-Salem State University, I belong.
Nursing education clinician, burn outreach is where I belong.
I'm a director of cardiac rehab. You should belong.
I am a staff nurse, and I belong.
I'm Karen. I'm a registered nurse, and I belong.
We belong at NCNA.